Whiplash recovery, exactly what to do and avoid in the first 30 days after an accident. If you're dealing with a whiplash injury, what you do or avoid in the first 30 days can make or break your recovery. This is where most people get it wrong. They wait, they guess, they try to tough it out, and guess what? You end up in pain for months. And sometimes you can have enough scar tissue buildup that this could lead to years of pain. In this video, I'm going to walk you through exactly what to do, and just as importantly, what to avoid during that first 30 days after an accident. You're going to learn the 5 most critical steps to protect your body, reduce symptoms, and actually heal. If your neck feels off and you're not sure what's safe, this video will give you the clarity you've been looking for. Keep watching. Also, I'm going to talk to you about a test that could save your life. I'm Dr. Gregory Kramer. I have over 33 years of clinical experience and advanced certifications in chiropractic biophysics. I specialize in treating chronic health problems like chronic whiplash, chronic L4, L5 disc bulges, chronic sciatica, chronic neuropathy, and chronic knee problems. I use a variety of non-surgical methods. I use specific targeted chiropractic adjustments, mirror image or opposite posture exercise, and mirror image traction to try to restore the spine as close to normal. And for those of you that would have any compression of the disc, bulging, herniated, or degenerative disc, we also use non-surgical spinal T-compression. Now, before I continue with this video, I need you to hit that subscribe button if you want to learn how to eliminate pain, avoid surgery, stabilize your spine so you can live stronger longer. All right, so the first thing I want to talk about is after a whiplash is something that's rare, but it can be life-threatening, and that's called a brain bleed. So very simply, if you think, or even close, that you have trouble speaking or slurring your words, or you've been knocked unconscious, or you have the worst headache of your life, you need to go to the ER immediately and get either a CAT scan or an MRI. You need to make sure that we eliminate that you have any chance of a brain bleed. Again, it's rare, but it can save your life. And I speak from experience. I've had family members that were in severe auto accidents, and I've seen almost probably 200,000 to 300,000 office visits over the last 30 years, and many after car accidents. So I specialize in ligament injuries post-crash. So number one, make sure you rule out a brain bleed. So the thing is that many times people walk away from an accident and think they were lucky. And I just had a patient today. It was very mild. Okay, did not need any serious treatment, a couple weeks of care, and they were fine. But other people are going to need years of care. So many people will have no broken bones, a little soreness, but guess what? Sometimes days or even weeks later, your neck is stiff, your head feels heavy, maybe you're dizzy, or worse, your arms are tingling, and everything just feels off. You try to brush it off. Deep down, you're wondering, is this normal, or am I missing something serious? So you're not alone. You're not crazy. Whiplash injuries can be sneaky, and what happens in these next few weeks matters more than what most people realize. Because the pain you feel now isn't just what happened then, it's about what you do next. So in the next few minutes, I'm going to show you the 5 things you must know to actually heal and the common mistakes that keep people stuck in pain for months, sometimes years. So let's start with these 2 mistakes you must avoid, all right? So the first thing is people wait too long. So remember, when you injure connective tissue, those are ligaments that hold your spine together. You're familiar with a disc, which is a cushion between the bones, but you also have 10 other ligaments that surround the spine. If you injure those, they will heal with or without care, but they'll heal with scar tissue. Think of scar tissue like gristle in a cheap cut of meat. That scar tissue can lead to chronic pain, chronic weakness, and chronic stiffness. So you do not want to delay care. So a whiplash can progress silently, and the longer you wait, the harder it becomes to fix the underlying issue. This is crucial. So if I were in a whiplash today, I'd first rule out a brain bleed, then I'd find a doctor, a corrective care doctor that's familiar with traumatic ligament injuries. Now, the second mistake people make is they jump into the wrong treatment too soon. Stretching aggressively, not good. Trying to twist their own spine, that's terrible. Or even getting a general manipulation. Now, I want to be very specific. What I would consider a great chiropractor takes a motion x-ray to determine if there's excessive motion in the spine or vertebrae that are frozen or stuck. He then would give a specific or target adjustment. That's much different than some of the things you see on YouTube where people are getting their necks twisted by who knows what. So you'd be very cautious. I would not let someone do that to me. So I would first make sure we get the specific treatment. I would avoid any of these general manipulations. I would avoid aggressive stretching. So those are the big things we want to do, and avoid actually doing anything that's heavy or hard. I mean, use common sense, okay? Start with the very first step every whiplash patient should take after an accident. Remember, we already ruled out a brain bleed, so now let's talk about the spine. So the most important test you want to get is a motion x-ray or a stress x-ray. That's an x-ray where you bend your head forward and back. And the reason why this is important, it can reveal hidden ligament damage, or what we call spinal instability. So a stable spine, you can put a load on it, you can move without pain or irritation of the nerves. An unstable spine will lose its alignment and cause, and this is important, either pain or a motor problem like weakness, or a sensory problem like you get burning or tingling or numbness, like I move my head and something shoots up to the back of my head or shoots down my arm, or I move my back and pain radiates down my leg. So the most important test you can get is something called a motion x-ray, because that will tell me if there's excessive motion or instability in the spine. This is essential to not only identify the true extent of your injury, but also it will start to quantify. So it'll tell you the location and the severity of any ligament injury, and that will guide your treatment, that guides your home exercises, that guides your return to work if you do aggressive or lifting, and it also will guide your hobbies. Should you bowl, that will guide your back to more vigorous type of exercise, okay? Now, along with a flexion extension x-ray, very commonly a good doctor will get an MRI. An MRI is another way to look three-dimensionally at the spine and ligaments, okay? And especially you need an MRI of your spine if you have pain going down your arms or legs. We call that a radicular problem. So if you've got burning, motor, sensory loss, motor would be a weakness, or you've got numbness, or your hands and feet are falling asleep, you want to get an MRI. So the two important tests are the motion x-ray to determine ligament injury, and an MRI to determine if there's any disc issues. Now the next thing we got to start with is early treatment. It's very important, because as soon as you injure a ligament, scar tissue starts building up. And if you wait too long, guess what? That scar tissue will heal, but it'll heal poorly. So with or without care, your body's going to heal. It just will heal in a bad situation. So a bad situation would be chronic pain the rest of your life, chronic stiffness, and a weakness. So ideally, the proper care sets the stage for no pain, sets the stage for good motion, and sets the stage for strong healing. So too aggressive isn't good, but too little isn't good. So very specific care, very gentle care, designed to gently reduce inflammation, designed to restore motion. That first 30 days are crucial, okay? We don't want to overload tissues, but we also don't want to have excessive motion. And this is where perhaps you might wear a neck brace for a short period of time. You don't want to depend on it, but it can give you relief in the first couple weeks. And then we want gentle exercises. Let pain be your guide. Everything we do should be good. Now, the fifth thing is we want to use corrective care like chiropractic biophysics to fix any structural distortions. It's very common when someone has a whiplash and they injure the neck. That means the head goes forward and back. You've injured the ligaments. Instead of a normal curve in the neck, we'll see what's called a buckle. It actually looks the opposite of a normal curve. And on the next video, I'll show you some ideas. So if you have lost your alignment, if you've lost the natural C curve or shape like a banana, guess what? The outcome is not good. You want to see a doctor that has the most experience and the best chance of trying to restore the natural curves. So that's very important, because the shape of your spine matters on the health of your spine. It matters on, again, pain, it matters on range of motion, and it also matters on the strength and your ability to go back to doing all the things you want to do. So chiropractic biophysics is a proven method that uses objective. That means you actually measurable. How we x-ray, how we do specific adjustments, how we do specific or mirror image traction, and also mirror image posture specific protocols to correct these distortions and restore long-term stability. So again, idealspine.com is the place you want to go to find a corrective care chiropractor in your area, and so they can help on your recovery. The first 30 days matters. Now, recovering from whiplash injury can feel confusing and overwhelming, especially when the symptoms don't always make sense. But the right steps, right healing is possible. If this video gave you hope or helped you understand what to do next, please like and share it. You know what to do. You never know who else might be dealing with the same pain silently. Now, I always love to hear your story. So tell me what you've done. If you've been in a whiplash, whether it's from a work or an auto crash or sports, let me know. I always like to know what treatment you've done, what you've tried, what helped, what didn't. Your experience might help someone else going through the same issues. And if you're new here, you know what to do. Like and subscribe the button. Very simply, share it to someone you know. On this channel, we share clear, practical guidance to help you recover from injuries, protect your spine, feel confident in your body again so you can live stronger longer. You constantly hear us say that term, live stronger longer. It's not just about living longer. You want to have high quality years, and that's what we provide here. If you're wondering whether your neck pain might be due to something hiding, something more serious, the next video you need to watch is this one, the hidden neck injury after a car crash whiplash. Go watch this video now.